3 weeks ago, I was Director of Infectious Diseases and a full-time clinician at the Canberra Health Services. At that time, I was working alongside my colleagues in intensive care through the executive of the hospital, anaesthetists, emergency physicians to develop the plan for Canberra Healthcare Services. This is to say that quietly and diligently over the past 3 and 4 weeks, intensive care units and emergency departments around Australia have been working towards increasing their capacity, as we've seen such horrific images coming out of Italy and the United States. So this dual idea of containment and capacity has been in progress concurrently, and I'm pleased, as the Minister has indicated, that today we can share some of that data with you. In particular, I'd like to focus on intensive care units and ventilators. At any one time, there is around approximately 2,200 ventilated intensive care beds in Australia. At the moment, we are using just over 20 of those for patients who are suffering from COVID-19. With immediate expansion, repurposing of other ventilator machines, including anaesthetic machines, and use of the private sector, we can expand to 4,400. Our target capacity for ventilated intensive care beds in Australia currently stands at 7,500. We are working round the clock to procure ventilators. I can tell you today that locally we will have 500 intensive care ventilators fabricated by ResMed, backed up by 5,000 non-invasive ventilators, with full delivery expected by the end of April. This capacity increase is being matched by workforce increases that I'll let my colleague, the Chief Nurse, Alison McMillan, discuss. I'm aware that colleagues in critical care, primary care, and throughout the hospital system are under incredible strain at the moment, looking at a wave that is crossing other healthcare systems in a way that we couldn't imagine. I think the Minister has actually emphasised that we are a very different context in Australia. Our death rate is lower, although those 19 deaths are a tragedy, and my heart goes out to those families. Our hospitalisation rates are lower, and our number of community cases are lower. But I would urge Australians, now is not the time to take the foot off the pedal. The restrictions that the Minister and the Prime Minister have introduced on gatherings are absolutely essential to prevent the virus from making its only move, which is from one person to another. So I would urge all Australians, follow those instructions to a T, look towards your state governments for exactly what they are telling you to do.